Okay, hello everyone. Welcome to Indian Occupational Therapist Think Tank Saturday Night Chat. This is an initiative we started in 2021, and every quarter we discuss a topic that influence OT practice or OT education in India. The premise behind this whole initiative is everything starts with a discussion. So that's a tagline for this initiative. Because again, those of us who got educated in India and then like practiced elsewhere, if you really look at how all those advocacy initiatives are started, like some people like really like sense the issue, they started discussing about it, and that discussion lead to the next step, and eventually like some policy level changes or practice level changes. And that's how we need to first like identify the issue, deliberate on it, because I may have one perspective, some other person may have a different perspective on the same issue. There may be some limitation that I do not like see, but the other can really like sense that. So I think when multiple brains collide, it'll be very insightful. So that was the basic reason of starting this whole initiative, and I'm happy to say that we are in our 20th Saturday night chat today. All the previous 19 sessions, the recordings of which are available on our IOTTT YouTube channel. So I welcome you all to search for it, or you can find the if you go to our website, you will find the link to each and every one of the Saturday night chat link there. So I welcome all of you to visit iottt.org. And also for those of you who are not yet members, I welcome also to join IOTTT as a member. With that background, so today the topic that we are going to discuss is quality of occupational therapy education in India. Lot of times we try to stay away from the topics like this, with the thing that, okay, if I say something, will I hurt someone, or will it be disrespectful, or like, will there be any problem? But I think we really need to talk about the topics like this, because that is going to influence the future of OT in India. And again, in the recent past, the field has grown so much with so many OT colleges. States like Karnataka and Tamil Nadu and all, like they have like sort of explosion of OT schools. There may be in other parts of India as well, I guess. So the attraction for OT is growing, but this is a great time for us to really like how are we doing in terms of the quality of OT education, and what can we do to improve? So that's going to be the backdrop of this discussion. And those of you who do not know me, my name is Karthik Mani. I currently work as an interim program director and associate professor at the University of Texas Medical Branch in India. So before coming to the US, I pretty much practiced in multiple practice areas, including cardiac rehab, mental health rehab, pediatric practice, neuro rehab, in all type of setting before I came here. And for the past 6 years, I'm in academia. So with that, I would like to get us started. Like, each of you, please, like, take maybe a couple of minutes to like, please be very candid. There is no right or wrong here. You don't, just be very, straightforward, and then like tell us your views about what you think about the quality of OT education at this time in India. Samita, may I get like, please get us started, and then I'll go with
Okay,
others.
no problem. I was actually waiting, Karthik, because I talk a lot. So I decided I'm going to stay quiet today, let other people talk. But if there are no volunteers, I don't mind getting started. I
Yes.
mean, first of all, I think my first suggestion would be our degree in India is a bachelor's in OT. It's not bachelor's of science in honors. Like, when you have honors degree, I think automatically the quality of the degree is totally different. So we don't do honors degrees in India compared to, and then I'm comparing this experience from my education in India and now in UK. So that's where I'm coming from. That I think this is where I think the competencies are set. So but I currently don't practice in India, and I'm not kind of involved in education as such in India. So possibly not the right person to comment on that. Uh, I've had a quick look at the new curriculum, I think, competency-based
Mhm.
curriculum for OT, which is uh, done by National Commission for Allied and Healthcare Professions. I think you all are possibly aware of that. Yeah. So I was looking at, and but of course, I haven't gone through in depth, so I really can't comment much on it. But what I hear from other people, because I recently had some workshops in Chennai, and this is what I hear from other people, that there are still areas which are not covered. Of course, again, I think things will change. Things might change because it is pretty new, and I think all universities or all colleges are still kind of getting adapted to this. But there are certain areas in terms of documentation. There are certain areas like professional identity, or possibly thinking about research, thinking about professional competencies. They are still possibly there is a big gap. Yeah,
Yeah.
I think more than me, if there are people here who are currently practicing in OT education in India, I think they would be the best people to say, okay, we teach this, we possibly don't teach this. And then uh, I can come back to that discussion and say,
Sure.
okay, maybe we can think about adding this to your OT education in India. Yeah.
Sure. Right, we have Mr. Revant. Welcome. We have Sophia Sad Madam as well here. Welcome, and others like Tamrai, Dr. Kulkarni, and Dr. Saravanan. Dr. Revant. Everyone, welcome. So, yeah, the educators in India. Like, what are your thoughts? You're doing the job there, educating future OTs. So, the question is pretty open and broad. Like, what are your thoughts at this time regarding OT education in India? Any of the folks from academia in India would like to chime in with their views?
Hello, Karthik.
Yeah,
Nice to
go
see you
ahead,
all
madam.
here.
Nice
Can
to
I
see you.
speak?
Yes,
Yeah.
please. Yes, please.
There is you can say quite a bit of change because a lot of things have now become more practical based, and lot of demonstrations and role play and all those things have been included in the curriculum. And for each topic, there are certain subtopics which have been very clearly defined.
Mm-hmm.
And there are, of course, there will be gaps, as ma'am said earlier, Samita ma'am, no? Yeah.
Yeah.
Yeah, there will be gaps because see, the perspective, everybody has a different view of thinking and view of looking at things. So over a period of time, I think those things will be included. But like this was when we were preparing the curriculum. I was one of the part of it. So
Mm-hmm.
there was a lot of brainstorming and lot of
Yeah.
things were discussed, and then only the competencies were prepared. So it took a lot of time and work from everybody, so that a very nice curriculum could be prepared. So at present, and because what is happening with OT education in India is that the uh, children who are coming, they are coming through NEET, and that there is no cutoff in NEET. The NEET score
Mm-hmm.
for OT and for the PT also as well. So the children who are coming are with very low scores, and because books are like American books, so it's very difficult for them to understand also the language, because they are coming from vernacular areas. And the basically the acumen that is not seen in these children, how to train, to grasp that concept and all. So now we, like, from our in our university, Maharashtra University of Health Sciences, they've also asked us to translate the curriculum in Marathi, like it is like that going on. So you can see I mean what all we have to compromise also sometimes, many things. So that is a thing. Yeah,
Thank
research
you.
and all has to be research has to be given more, and that has been given in PG more. The impetus has been given. Yeah, and there are new areas in which we have ventured into, but we need to venture into more. Yeah.
Got it. Samita.
Oh, thank you so much, Sophia. That was really comprehensive and well done. And congratulations for your contribution to this new curriculum.
Thank you.
I'm sure. I think writing a curriculum is not an easy job. I've written two curriculums in the UK, and I know it's a big responsibility and it's a huge task. It's a mammoth task. So well done for that. I'm just trying to understand why do the Maharashtra wants that in Marathi. I mean, the reason I'm asking this because see when I go to these conferences in Europe, there are some European countries they deliver occupational therapy in their own language. So, for example, in Germany, in Czech Republic, they still do it in like their own language, and
Mm.
that's the biggest barrier because barrier in the sense the students who are learning in their own language they really can't work globally. They really struggle working globally because English is a medium of instruction across the globe. And when and again there are lots of restrictions in terms of having some guest lecturers or something. So the exposure for these students is very limited when they do it occupational therapy in their own language. So I really don't understand. Do you know why they want in Marathi? I know. I mean, I'm Marathi. I'm from Mumbai, and I know there is a big kind of I think it's more of maybe a political move that everybody has to speak in Marathi, which is fine. But I think when it comes to education, people have to understand how the education can be represented at the global level, how our students are going to really, grow in their career at the global level and not just
Mm.
the national level or possibly not just the state level. Yeah.
Yeah, ma'am, you are correct. Actually, globally, we are seeing a lot of things. But then, see, in India also there is requirement, and that's why many people have gone abroad because they found better opportunities over there. But as I told you earlier, also that children who are coming from vernacular language background, they are not able to cope up with the things. They do not understand the concepts. Because sometimes it's very abstract. So uh, to make it more convenient for them to make them understand, if they understand the concept and they can convey it in Marathi or whatever language, then I think that's good. And besides that, they will stay here. Most of them will stay here. Hardly 0.01% will go to US or UK, wherever they want to. But then and they are going to be in the rural areas or wherever they are working. I mean, wherever they are native places. So many children are now also opting to work in their own native place. So there they will have to, convey the things in Marathi, and they should know the terms and terminology. It's not that they're writing their papers in Marathi. The thing is that at present it is not there. Maybe in future it can happen, but then nowadays we also ask them, okay, whichever language in best you can convey, you can speak, like in practical exams whatever the language they are able to convey in, if the concept is okay, I mean, they are able to convey, that means they are good in their knowledge base. So I think, it's we cannot say no to everything. We'll have to look at the background of it also, okay, why it has been uh, being implemented.
I'm on the same view, Dr. Asad. Like, I always like, from my day one, since advocating for occupational therapy in India, like the cultural and linguistic adaptations are too critical.
Mm,
Then only we can
mm,
promote the profession in India. Of course, I do
mm,
acknowledge some of the limitation the potential graduates may face in the future in terms of international mobility, but there is always opportunity. They can improve their language, and if they have
yes.
that aspirations, all there'll be opportunities for that. So I think it's very critical that they understand
Mm,
the OT with respect to in the context of the Indian culture, in the context of the
culture.
Indian language, so
Mm,
that they can easily able to communicate with stakeholder. That's so critical. In a way, it's
mm,
positive. On that note, Dr. Asad, when you're working on the curriculum, if you're drafting a Marathi definition, I would request if you can share it with IOTTT. We already have definitions of OT in a very not very like a
mm,
scientific definition versus like a layman definition. So we have
yeah.
the version of definition in Tamil, Hindi, and English that can easily be
Mm,
explained to stakeholders on our IOTTT website, and we want to actually add more of that in
more
in
language.
all
Mm,
in regional languages, so that people can
Mm-hmm.
use that as a resource. So if you can, please share that with
Yeah,
us.
yeah, sure, sure. Yes.
Yeah.
Thank you
Shobana
so
ma'am.
much for allowing me. Thank you.
Yeah, thanks, Karthik. Hello. Yeah, thanks, Samita and Sophia for having your input added on into this chat. It's a very, very important and crucial elements that we were discussing here today. My concern and my suggestions would be like I hear what Sophia has mentioned that some of the students are struggling, and I see that it's mostly because of language barrier. And you guys are trying to help the students learn the concept, the occupational therapy concepts in their language, so that like I understand that you're trying to get them a better occupational therapist. And also I noted that you mentioned that they're not being examined in their own language, so the examinations are happening in English, if I'm right. But they've been taught in the practical sessions and in the viva that they could speak in Marathi, if that is what you were trying to
Mm.
convey. In
Yes,
fact, like, I would agree to that, but then still I wonder, or like read that what are the regulations for that? Do you guys have a policy if you're like adding this additional support to the students who have a language barrier? Do the university have a policy in teaching the children in Marathi, or for example anywhere, like say in Chennai, if some of the students are taught in Tamil, that's fine. Like it is very important that children need to understand the concept, but at the same time we need to be also balancing the it is very essential to have this like the regulation to be carried over in the future as well. Like for example, if Sophia is not there, someone else is coming in the future. Like, is there a policy for the students to learn in Marathi? And if they're not examined in Marathi, how are they being tested their like their potential? So I think that it's good practice, but at the same time we need to have some policies and some regulation to maintain the quality of OT education. That's one query that I had. My another query is, Sophia, do you think that
yes,
these children are struggling at the first year where there's more medical model of learning happening in
Mm-hmm.
the curriculum? For example, like I remember when I
Okay.
was in, like learning OT in India, the first year
Mm.
is pretty much like, what the medical students learn, the anatomy and the physiology, like in depth of what the medical students learn. And it is, to be honest, it's too heavy for a child who wants to learn occupational therapy, but not in the medical line. Do you know what I mean? Like, so are we still stuck
Mm.
in that medical model of education? Do we need to reflect that
Yes,
on? Yes. So that's the
yeah,
thing.
yeah.
See, if yeah, so in that case, do we really need to reflect on the curriculum? I mean, um, I understand that that has been happening for several decades in India, that, that is how we all been trained. But is this not the time to rearrange our education system? Should we not look back and reflect on, like, why do we need that depth of medical model education to become an occupational therapist? Do we need to reflect on that? Like, so I feel that these are the things that we need to answer. And also, like
Mm-hmm.
suggestion, make some suggestions for the people who are amending the curriculum in the educational system, especially for occupational therapy. Like I think that is where we are today. One could be this Saturday night chat be an initiative for that, you know?
Mm-hmm. Yeah, see I mean, Marathi curriculum as such, like we have some concepts we have to teach them in Marathi, and like what you said, how I mean, because we have to make a balance of it, of course, and basically the anatomy physiology part is mandatory. Only the bio. Now this time we have changed a little bit that biochemistry has become a more of college subject. It will not be tested at university level. So that anatomy and physiology base has to be there in order to for them to understand range of motion, muscle testing, sensory evaluation, all that has to be there. So and of course later on when they are doing the application of those things systems, like for the OT in surgical conditions or OT in medical conditions, that they need to know. So I think that is okay with them. Uh, they need to go to that rigor. I think we have to have that medical model also in, but later on, it all converts into how those things are, I mean, applied to the occupational therapy treatment part. So that
Yeah,
will, and
yeah, I
besides
do.
that, this our model is like a very good model of teaching, although it will be very rigorous for the students, but then ultimately they have a very good background knowledge about things. So I think
Absolutely, I cannot deny that. But at the same time, do you think that well, of course, we do need to learn about the anatomy and the physiology as they make the background of, like learning further.
mm,
There's no doubt about that. But however, I still feel that the depth of we learn, well, anyway, like where I'm not quite sure like how it has been modified now recently, but when I studied,
mm,
it was very in depth, like and I now, I feel that why did we study in depth of just not the anatomy and physiology, but many subjects like the biomedical, the bio, the one that you were mentioning, the biomechanical approach
biochemistry.
and things like
Yeah.
that. Yeah. So why, I mean, yes, we do need the background of it, but at the same time, the depth and the more efforts that our students put at the first year, I think we need to relook, and like maybe we need to look at from occupational therapy perspective, what do they
Mm.
learn? Because I'm sure like when you ask your first year students what do they understand about occupational therapy, what do they say, especially the first year students, do they really
Ma'am, we
understand?
have two subjects of occupational therapy also in the first year.
Mm-hmm.
Fundamentals of occupational therapy and occupational therapy diagnostics. So in that
Mm-hmm.
we teach them about occupational therapy, what it is, performance areas, performance components, and all that. And they get a brief, I mean, background of the what is occupational therapy basically, about the assessment work, what is assessment and yeah, yeah, अपना evaluation and assessment, what are the different types, in the historical background of occupational therapy, then ADL, then so all that is being taught in the first year.
Okay,
Mm.
that's
Suresh.
really good to hear. Yeah.
Yeah.
Yeah, Suresh, please.
Uh, Not a problem. I'm going to actually talk after Tahira, please, because she's also raised hands for a quite long time. Tahira,
Okay.
if you want to go now, please go ahead. I'll go after you, please. Thanks.
Yes, thank you so much. I am an occupational therapist. I'm working in Bangalore, and recently I've been interacting with a lot of juniors coming in from different, actually cities, from Coimbatore, from Kerala, for work experience in Bangalore, even from Kolkata. And in the current scenario, which I am seeing in them is that they do not have a very strong medical knowledge. Like what they get excited about certain diagnosis which they have observed in their learning phase, and they are completely unsure of the other diagnosis if they have not had the chance to see firsthand in their learning experiences, and they are very hesitant about that. And so that, and second thing, they are having lot of generalized idea that okay, if a child is coming, I will work on fine motor skill, gross motor skill, like how we do an activity analysis or understanding the occupation of the person we are treating, even considering that part, that what level of fine motor skills or gross motor skills will be required by that person to achieve the occupational role, like customizing the therapy for a individual, that is not happening. They like to put the set like activities that I'm doing fine motor activities, I'm doing gross motor activities, I'm doing this, but are they meaningful and are they important for the client as well,
Mhm.
is something they are not applying that much. They are
Correct.
more about very like how we were taught that okay, you have to think that okay, the person is a carpenter, so no, you will have to focus on the shoulder strengthening more than the hand strengthening. Or the person is a clerk, so instead of shoulder strengthening you will focus on more on the wrist flexibility and writing. So like how we used to, protocol is there definitely, but how we used to customize based on the client, that is actually very less by them. They have this like okay, if a particular diagnosis is coming, this is the protocol I will be doing. I will be doing the knee exercises, I'll be doing the hip strengthening. But is it meaningful, is it customized to the client, is actually not happening that well. And again they are also like telling that oh, it's like similar to physio only. What is that different about being OT? Like they are really not getting the niche which we have. And especially when it comes to pediatrics, then they and every autism case is different.
Mhm.
Every ADHD case is different. So they're really not able to gauge and change the therapy protocol as per the children. They really want to like okay, I'm going to do vestibular, I'm going to do pro, and then I'm going to do fine motor. They're like trying to fit every child in a protocol rather than
Mhm.
changing the protocol to the client,
To the
which is
client.
the niche of
I have,
occupational therapy.
yeah, I agree with you, Tyra, and really, it's very difficult for the children to understand because this is very complex things that it is there. Or
Yes,
जैसा I mean कि that जैसा I told you now, the acumen is not there in the children just now at this stage, so that they are not able to grasp that particular concept or why it is happening, and they don't think, like when we were studying now, we were never given a diagnosis. We had to do differential diagnosis, and that time we used to think so many things कि हाँ, ये भी हो सकता है, वो भी हो सकता है, ऐसा भी हो सकता है. So that made us think and then analyze and then come to a conclusion. But here the
correct.
children are given the diagnosis, and that's why
No, but
yeah.
what is happening with them is that they are not getting enough exposure. Like
Now we
if
have
they
lot of exposure. Tyra, in GMC Nagpur, there is lot of exposure. I
no, no,
mean, there are
so it is that a particular right now, ma'am, lot of private universities have come up with the BOT
uh,
program and
that
they're
is there.
charging a very hefty fees with
Hmm.
zero exposure to the kids. Like
Hmm.
literally, they are like, okay, we go for 1 month for 2 hours to a particular hospital for a particular department. That's
Oh,
that. To just meet the
okay.
criteria. They are not having exposure to the number of cases
Hmm.
which
Yes.
a government
Hmm.
institution would have
Hmm.
for those 4 years. They are literally having 1, 2 cases experiences, that too as a group
Hmm.
of a particular person. That is it. Not even like a particular demographic also.
Hmm.
They are not even seeing multiple cases of CVAs. They are not even seeing multiple pediatric cases of cerebral palsy. No, they're
Hmm.
like one cases of each different diagnosis. They are not even seeing the demographic like knee replacement. Knee replacement can be there for a 16-year-old, 25-year-old, 50-year-old, 70-year-old. But they are seeing knee replacement for a 50-year-old. So the exposure for them is very, very limited, right?
Correct. Thank you,
And they are
Tahira. This, yeah, go ahead.
no, no, means that is why they are really struggling to understand when they come in the field to work, because they've
Got it.
not got that much of exposure in their
Yeah. And
education time.
Got it. Yeah, I mean, I have like, like, first of all, thank you so much for the candid observations. You were spot on. Thank you so much for sharing your views. Apparently, like you highlighted that students were unable to like articulate the unique value of OT, and also looks like they were more into diagnostic or procedural type of reasoning. Then, like, I think the clinical reasoning is the area that we need to work on, which means they need to have a good grasp understanding of what OT is, what the client needs, what can I best do given the circumstances for this client, so what value I bring to the therapy and the client, right? So those kind of things, that's all great. And also I just want to briefly say, to Harshada's point that in US, for the entry level education, Harshada, we do like strong anatomy foundations. I teach anatomy for the past 6 years. In fact, yesterday I was in the cadaver lab dissecting a cadaver for the upcoming class. So they do like we use a lot of anatomy technological resources like anatomage tables, and also they do a little bit of cadaver reviews every during the semester that they learn anatomy. Anatomy and physiology in my view are very essential subject, for all medical professionals to learn, including OTs. But I do agree with Shobana ma'am's point about the depth of other medical specialty subjects that we learn. The only question I believe that we need to ask is how much of the information are we using, and then with that once we need to ask that question and collect some data on it, and then with that data we need to look at the existing curriculum and then say, okay, how much are we actually using of this, and then like what other portions can be minimized so that we have more room for like OT clinical reasoning. Like we teach them about the process from screening to discharge. Like there are a lot of areas that we need to, and also like how to advocate for the profession. So leadership management aspects of OT is not covered in the entry level education in my view. So there are a lot of areas that already it's 4 years, and I believe now it's going to be a 1 year internship. It's going to be a pretty long program. So we really need to be strategic of removing some of the content that we may not be using that much in the future, or maybe we can move that into a master's curriculum where it's more focused and specialized in one area, and then we can keep the entry level curriculum with all those areas that we really need to include, which means we need to make space. One thing, based on my experience working in India as well as in the US, is that we have strong medical foundation. In a way, it's really good. At the same time, how much of the information, depending on the setting, depending on the population, if you're working in an acute care hospital, the volume of information that you might be using might be a little different than you're working in a like a community type of setting or a pediatric outpatient clinic and so on. But anyway, I saw a lot of hands. I'm going to go with Dr. Kulkarni next, and then followed by we will invite others who raise their hand.
Hi, thank you so much. So I'm working in a private university. So as Tahira pointed out very clearly that the private universities there are many OT colleges which are opening up. So yes, the government colleges do give more exposure to for the clinical practice, but it is comparatively limited in the private universities. That is very true. But then again, the other part is which we are missing is the students. The students have changed. The thought process of students have changed or upgraded, some to good things, some to bad things. We have many students who have taken the admission in OT just so that they want to go abroad, and they are not at all interested in learning anything or knowing anything. They don't have any compassion, or they are not of this thought process that I want to help someone, I want to make them say walk, make them do ADL, treat them better. They just want to go out of India. And in private universities, the admissions generally happen through agencies. So the agencies openly tell them that if you take engineering, it will take a lot of time. If you take PT, it will take a lot of time. If you take OT, you can fly immediately. So that is the majority of the reason. So when such students are learning and passing out, when they go to practice, it is really like, even if the curriculum is better, the teacher are good, the clinical exposure is good, but still their practice will be limited because they wanted to do it just to fly abroad, and they did not have much of, like, if I have 40 students, only 5 students will be genuinely interested in understanding what is OT and how it is. Remaining 35, they just wants to pass, get degrees, and somehow it is like in private you can get a degree easily, or some new universities just push you through, or the agencies have promised them something else. So that's why these students are coming. So we should have the curriculum focus on these things also, that we have to make them understand this, learn this better, and keep it interesting. And so there should not this thing which have is planted in their minds, that okay, if you take admission in private you will be just pushed through. That for that we need to work.
Yeah. Thank you. Thank you, Dr. Kulkarni, for your observations. Tamarai, Tamarai, unmute yourself. Yeah.
Yes, good evening, everyone. Thank you for giving this opportunity. So, when we talk about basic OT and all, I think it's necessary to have the strong basics in anatomy and physiology so that see what we I think all the way in a long run we have fought for getting the doctorate things and all. It's very important to have the basic skills also, like in the basic knowledge in anatomy and physiology. That I agree with that. If we change, we are answerable. You don't know anything, how you can request for this doctorate thing and all. I think for that purpose we need to have a strong basic in anatomy and physiology, and then medicine things also. One point. Second one is when we talk about languages, no, um, when we especially work in a psychiatric sector where we work more with emotional concepts and all aspects and all, it's very very important to learn the language so that we can express what we feel about the patient, and it will be easier to understand us about the patient's perspective also. It's based on individuals interest of learning languages, multilingual, becoming multilingual. It's very very basically based on each person's interest and upgrading their knowledge in language as well as in their what to say, the field of work and all. That is one thing. And something called the client centered approach only we use. Instead of our patient is coming, we just do push the activities and all. Instead of that, we use the client centered approach so that we are getting more views from the patient so that we can work according to their point of views. So these are the three things I just wanted to share. Thank you so much.
Thank you. Thank you. Suresh, would you like to go? You've been like waiting for some time.
Thanks, Karthik. I'd basically value all your suggestions, but I would want to actually look at it from a different perspective. We are all talking about anatomy, physiology. We are all talking about what students would like to learn or what students would like to know, but we are not talking about everything that we do as educators. Are we doing the right thing? I think that's the first step towards understanding the answer to the discussion tonight. Uh, I'm just giving examples, and I'm not pointing to any person, especially Sophie ma'am for being a part of the curriculum committee. I'm not expecting answers from any specific person, but in general, to look at with examples is we say the current curriculum is evidence based, and we teach people about multidisciplinary team rehabilitation in India within that evidence based curriculum. Do we have multidisciplinary rehabilitation teams where occupational therapists are mandatorily wanted in either government or even private or even civil societies to work together? So although we say evidence-based, we don't have a system to practice that evidence-based. So how do you teach students about evidence-based occupational therapy in that context? We should think about this. We talk about anatomy and physiology. However, Samita and my colleagues, like Shobana ma'am has said, will definitely agree that in the UK, the overall course in occupational therapy, whether it's BSc or a pre-registration MSc, where you do not have to have a degree in BSc to get an MSc in OT, they don't have not even 10 to 15 hours of anatomy and physiology. And you have 38,000 occupational therapists in the UK practicing, following the same curriculum, which means whatever we are talking about, a 6 month semester for anatomy, physiology, pharmacology, and all that, it's not required. But what is more predominant in these settings is the core context and science of occupational therapy. How many of us in this specific discussion for 40 minutes have spoken about our own science teaching students about who we are, how we have to practice, and all that. We are talking about language as a barrier. Language is definitely not a barrier. There are Chinese students learning in America, learning in Australia, learning in the UK, and practicing as occupational therapists and practicing also as entrepreneurs. So it's not about the language at all. Even in an Indian context, we are talking about Marathi version. Why are we not talking about Assami version? Why are we not talking about Northeast language versions for India? Because we don't have schools there. Should we ignore it? When we talk about language, it actually means that we are not inclusive in our curriculum. We are not talking about what and how to teach students if they do not know English, being an Indian student. So the problem is with the people who teach, people who include students and make people learn occupational therapy rather than the students who come. Uh, Whatever we teach is what is going to be coming out from these qualified professionals outside. So I think, and I'm requesting everybody to talk about these aspects as a point for discussion, please. Thanks.
Shobana, ma'am.
Thank you, Suresh. That was a very great view, and I absolutely agree with your like point of view and suggestion. And moving forward, I have like few things in my mind that I was thinking about when the other people were talking about like how difficult it is for some fresh graduates to practice in different part of India where they qualified from, say, for example, in Tamil Nadu, and then they gone to another place in India where there is a mismatch in their practice. And my question would be the same as Suresh, like, so do we not have a uniform strategy or uniform curriculum all over India? If we do, why is there a difference? So I would put the question back to the educators and not the students. Because the students learn from the educators who are practicing in various parts of India. So I think it is a very like important element that we need to focus on. So do we need to make any suggestions in like in teaching the curriculum of occupational therapy and to make that as a uniform practice all over in India? And that's one point. The other one that I was looking at is like I do agree that a lot of people who want to go abroad and practice, and the exposure of clinical practice in India is some of the person has mentioned, one of the person has mentioned that the exposure to clinical practice is limited in India. However, having viewed different international practice education in different countries, I've observed that in many developed countries like Australia and the UK and some parts of the US, they do not actually give much exposure to the students to practice directly with the clients due to the privacy and confidentiality and GDPR and things like that. They get to practice with the actors. Do you know what I mean? Like, so, these are the students who do not have much hands-on with clinical direct contacts with patients. However, in India, we are so lucky that we do have that practice still ongoing. So I feel that we actually could make much out of it by looking at the education system rather than looking at the student's perspective. That's my view. Thank you.
Thank you. Real quick, just my thought on, the students who are joining the OT program in a lot of new institutions, their focus is pretty much going abroad. I just want to like give a different perspective. I see that as an opportunity because if you really look at the global demography, India is the only country with huge amount of like working age population. So I believe like in the near future we are going to be the global supplier of manpower. So in a way it's an opportunity, but that's up to the individual decision whether they want to be here or not. But I think from an educator perspective, we need to focus on how can we make them a skilled and compassionate OT with the necessary knowledge and skill set, and they are going to like practice wherever they are. Even if they're going outside India, I think they are representing our nation. It'll still be like if they do a good job, it's really going to be a great reputation for us as well. So I just want to give that different lenses. Like yeah, one side we can see that from one way, but there is also we can see that as an opportunity. Tamra, you still have something to say?
Yes, sir.
Yeah,
I
go ahead.
just didn't add something else. So, when we talk about the exposure with the patients and all, I think in India, 50-50 we can say. So, 50% of colleges having really very good exposure with the patients, with the students and all. So, with the supervision of the staff and all. But I think uh, in colleges or university where they are recruiting more than like 50 or 60 students and all, there that exposure is missing. That is what my understanding about the students perspective. So we work a lot of students coming from different cities of India and so this is what I have heard. So 50-50 percentage of good exposure as well as not good exposure is also is going on here. Okay, thank
Yes,
you.
I totally agree with you. In places like, say GS or GMC Nagpur or CMC Vellore and all, there's like, they have access to, such a variety of clients and they have a lot of clinical exposure. So through experiential learning, they gain a lot more skills. But is that the same case across India is the question that we need to ask. And that's where all these standards and regulations come into picture, if there's a requirement. And also the way, like, there are some other areas that we need to think of is the way we assess student knowledge, right? Do we need to really think about it? How are we assessing their competency? Do we have a competency based framework? And then, like, for example, like a student who's coming out, like, do they have a basic understanding of research? And the OT process from screening to discharge, how that looks like in the Indian context. And also, even now, I think we are still using a lot of Western models and Western textbooks. I think that's also need to change. We need to create more evidence, with respect to the context of OT practice in India, and then use that evidence to educate our students. So that way they can really apply what they learn, and that there's a like a good alignment between what they learn and what they see in practice. That is another area that we really need to work on. Again, great points, and we still, like we start around 8:40, so we can take another like 10-15 minutes to continue this conversation. It's going great. One resource I want to point out, like not point out in a sense, like one resource that we worked on and we are still kind of like polishing it is a curriculum commentary regarding OT education in India. So IOTT experts come together. We already have a manuscript that we are finally polishing, and then like it went to one journal, came back, but then we are planning to like submit to another journal. So very soon that resource will be there where we really kind of like brainstorm on multiple topics. That's going to be very soon. I hope it gets published soon. So just want to highlight that resource that's coming down the pipeline. All right, Tahera. You're muted, Tahera. Please unmute yourself.
Oh, sorry. So it's just a suggestion. I am a practitioner
Sure.
right now. I am not in the education field as such. But one of the suggestion I would want to give is lot of like we can include thesis like presentations, research, not just in the final year for a particular topic, but introducing it early on. So that will help them go around and collect the data, see like they find resources that where can they find that particular demographic, and they go and interact and do the questionnaires, or like not in a complete manner, but a very important part is also research. So and with with the help of AI and everything, like it can really give them both things. They can figure out where they can get that particular demographic, what is the problem they want to assess, like just them brainstorming that what can they get out of a particular project, like that. What did they learn out of it
Out
in
of
the
it.
OT context? So like how we
You're
do
talking
like
about Yeah. Yeah, you're talking about reflective learning, which is very great, and we use that a lot. Like, basically make them do something and reflect on it, and then like say what I got out of this, how can I make this, how can I modify this, how can I make this better? So those kind of reflective, especially during clinicals, fieldwork rotations, we make them really do a lot of reflective journaling, and then like, help them generate their own insights. That's a great point. Thank you. Suresh.
Karthik. I have one specific point to make. See, when we are trying to look at curriculum, when we are trying to look at education, I think it is absolutely ensuring that we are evidence-based. You know, not in the sense what evidence we are talking about in occupational therapy, but when we say this is the curriculum, this is what we have. At least is there evidence that the perceptions of students is captured in the curriculum? Is there any evidence that the students say we need 6 months of anatomy? We don't need this specific occupational therapy thing. So we don't have the perceptions of students who are learning occupational therapy in our country to base the curriculum on their perceptions. I think that's the start point for all the educators. We all teach occupational therapy, but have we ever taught that these people are going to go out not just to the same place where we are now, but also to a place where we may not be, and what they will be doing. So I think educators have to be practicing evidence-based teaching. And then any evidence, or the word evidence, is really powerful. And I think when we are using that in occupational therapy, we have to deal with evidence for the change that we are proposing, even if it's going to be a national initiative, or look at evidence that's there for practicing occupational therapy based on the local evidence. You don't have to talk about whether sensory integration works or neurodevelopmental therapy works, but look at, do you have any assistive device for somebody without mobility aids to be prescribed free of charge in a place which is either remote or even cities? Every time we look at all the WhatsApp messages, we still have people asking, is there an OT in a specific city's specific place? Which means that there's lack of knowledge about what's happening around us, what's happening in our profession within our own state or region. And we also do not know whether we are in the right direction for the future, looking at ourselves as globally standardized occupational therapists. We are just looking at whatever is taught. And as somebody was saying, we are learning to go abroad. That shouldn't be the way in which we look at things. But this is coming from experience of seeing people in that specific mode. But it's not our responsibility whether they are going to go abroad or earn abroad. It's their specific wish. But are
Their
you doing
choice.
what you're supposed to do from your angle to a student is what is more important. And I think collaboration is very important. Open talking and constructive debate is very important. We can't keep talking about the mistakes alone. I'm sure IOTT has been trying to make some fruitful collaborations with All India OT associations, as well as some enthusiast educators in the country. So we will actually strive to do whatever is possible from that angle. Thanks, Karthik.
Thank you. Thank you, Suresh. So I just want to call upon Dr. Naina Hatwar and Dr. Yasmin Sanjaliwala. Just, they're here. If you have any thoughts that you would like to share, we value your perspectives as well. So Dr. Naina, would you like to share some thoughts related to OT education in India? Okay, Yasmin, would you like to go? Yeah,
Hello, it's been 10 years now. I have left India, but I just want to give suggestion that the first year
sure.
should be encouraged with creative thinking, like
Sure.
to ADL, ideal problems. They should have an insight, open-mindedness, and also shadowing the clinics should be right away from first year. Like now I'm in Canada, I see a lot of students at my workplace They are still in 10th grade, 11th grade, and they get a chance to shadow us. So it makes a huge difference that they decide what are their potentials. So the colleges and the clinics, if they can offer such things, it would be great, like volunteers.
Excellent.
Like the for the volunteer hours at least, so the future kids know what are
Kids.
they are entering into. Like
Got it.
when you are struggling with your license and all stuff, like it's really hard. You try to fit into different areas, and then you remember, oh, I should have worked more here when I was in India. I could have done this, I could have done. Yeah, so
Got it.
yeah, it's been 20 years now. So yeah, a suggestion to the future generation now. So you
Excellent.
guys,
Thank you.
sorry, I joined the session late. So you guys are trying to implement a new course and syllables in Indian education for OT?
So yeah, there is a new curriculum put forth by the National Council for Allied Health Professions, NCHP, which is like a government entity. You know, that they're trying to, like, I think that's a body that's going to eventually regulate OT practice in India. I mean, they are. I mean, it's been, you know, legal. So the council has put forth the curriculum, and then a lot of it invited stakeholder input, and also it's available in the public domain, Yasmin. So
Yeah.
feel free to search for it. NCAHP, you know, OT curriculum. You will be able to. It's a big, very big document that comprehensively covers bachelor's, master's, and not sure
Right.
even the doctoral curriculum. I guess. Yeah, you
Also,
can take
a
a look at it.
suggestion that don't make
Sure.
it too much strict to Indian thing, like to clear a license thing, going through so many stages, paying so many bills to each phases, and then getting the license. It's a really struggle, and some people lose motivation. So it should be easy, friendly, and the accountability should be judged well in that quota. Like in India, we have a very tight budget, right?
I think you know, the observation idea was great, because like here, you know, I work in academia, like, you know, as part of our admissions criteria, the student have to show documented observation hours of X number of hours in order to get into the program. So that's a great suggestion. So the students know really what they're walking into is a great thing.
Yeah.
Um,
Thank you.
Awesome. Yeah, you're welcome. Thank you. Thank you for sharing your thoughts. I think, you know, in the next 5 minutes, I just want what are the number of people remaining here on this call? Just kind of tell me two things that you think. I mean, there's no right or wrong answer here, just your perspective. What two things that you think we should be doing to improve the quality or further improve the quality of OT education in India? Okay. Um, Suresh, what are your two things that we need to focus on? I mean, of course, there are
I
multiple things, but just the top two.
I think the first thing to focus on is to handle students as students, giving them a very supportive experience of learning and becoming a good occupational therapist, not pressurizing
Got it.
them in the name
Mm-hmm.
of marks or on various other things which I don't want to delve into. Students should
Mm-hmm.
learn happily and then should learn occupational therapy as an important science in their life when they join our course in any educational institution. So that's my first point. The second point is primarily do not recruit anybody who's finished occupational therapy with 1 year experience practicing occupational therapy as assistant professors in occupational therapy in any academic institutions. Have a rigor about what they know, whether they are good at teaching or not, because we don't have teaching qualifications in India to know that whether somebody is a good teacher or what should be taught in what ways and what approaches. I think the second thing is having a good faculty to teach
Mm-hmm.
occupational therapy with all levels, right from associate lecturers to full professors,
Mm-hmm.
especially in the science of occupational therapy, is something that is crucial. So don't uh, let anybody who's an occupational therapist to teach in any occupational therapy institutions just like that. Thanks, Karthik.
Got it. Thank you. Shobana ma'am.
Can I come back later?
Okay. All right. So I will just kind of like tell my two things. One is obviously we want to contextualize the OT education more, you know, more relevant to OT practice in India. And also, I believe we need to look at the way that we are assessing student competency skills. You know, we need to really make it very more meaningful, the way that we evaluate their knowledge and competencies. So those are the two things that I believe should be in the top. And eventually, there are many things we need to focus on. Harshada, would you like to go next?
Sure. Second. Yeah, so my 2 points would be first will be to contact the educators who are in institutions should have good contacts with the surrounding clinics, different kind of settings, so they can take the students there and see how the occupational therapy process follows. Like say after the patient is discharged from the hospital, okay, what happens after that? How do they get equipment? How are they followed up with the rehab? How will they even cover their rehab? They need to know these things so they can have their own plans when they graduate. And my second point was like Dr. Sophia said that the mental acumen of the current student is not that good. So what are we as OT educators using methods to help them? Like are we using getting away from the presentation and the blackboard? What are we doing for them to so that they can digest the material well? Are we using drawings or patient demonstration or going to other hospitals? What are we doing for them effectively so that they can understand that well? Those are my 2 points.
Excellent. All right, Tamare.
My answer would be, see, when we talk about OT, everybody is just focusing on ortho, neuro, like this only. What I just wanted to give a suggestion is, it will be better if they are more focusing on other areas like psychiatry, geriatrics, oncology, all those areas. If they are more focusing, that will be better. And we also, when they come as a students or observer or clinical posting since first year itself, we just try to encourage them in all the areas so that they can be more confident enough to pick up those particular areas of interest. That is the thing I just wanted to say. Thank you, sir.
Okay, thank
Yeah.
you. Tahera.
Uh, I would actually agree with all the points of Harshada, because that's going to really change the experience which I am having with the newly graduates. I
Got
think
it.
that will answer all the things which they are struggling right now when they're coming out. So
Got it.
yes, yeah, agree
Okay,
with Harshada completely.
got it. Okay, Yasmin.
Um, Quality in the basics, right from anatomy and things which are relevant to our field, and employment opportunities, and open-mindedness to try in all domains, not sticking to just one field, but trying
Okay,
different areas, and yeah, trying to
got it.
strengthen that area. Yeah. Thank you.
Perfect. Thank you. Those are all wonderful insights. In general, I just want to, conclude this session by saying that, when we look at the quality. Oh, sorry, ma'am. I just thought like, you haven't shared. Yeah, go ahead, please. Go ahead.
That's okay. I just wanted to, like the wait for everybody so that, like I
So,
am not repeating the points.
got it.
Yeah, I
Got it.
would agree
Please.
with each and every one of them, what they said. And added to that, like as I was mentioning earlier, I would emphasize more on an uniform and updated OT curriculum. For nation-wise, and also, focusing on the students' confidence in learning occupational therapy from day one, and introducing the occupational science in their curriculum. That's, I think, one important thing. And the second one is, providing quality clinical supervision placement for those students is highly important, because we do leave the college, but the students go for various clinical placements, and we need to look at that aspect as well. Like, do we have, because I remember, like, when I was practicing in India, students used to come to my clinic for clinical placement, where I developed a lot of clinical agreement between the universities and the students, the learning outcome, things like that, which are all new for them. So I believe that that's something we need to look into it. That two things I want to say. Thanks.
Excellent. Yeah, very valid points. I think, yeah, we need to have some supervision guidelines, and then like we need to make sure there is some sort of a competency assessment at the end of the field work rotation in each setting so that, we can evaluate their skills and competencies. One other aspect that I wanted to mention is that, we need to also look beyond the clinical part of occupational therapy, like, how systems influence occupational therapy, how research influences occupational therapy. We need to talk about management aspects. We need to talk about leadership, how to engage in professional advocacy. In order to like for them to live in this, like there are multiple factors beyond their clinical knowledge and skills or their knowledge and background. There is so many other factors influence practice. So when the student really come out, they need to have an idea, because if they're only like thinking about, do I know the diagnosis, the symptomatology, what assessment to do, what intervention to do, but there are other factors, legal factors that they need to be aware of, what legislation influence their practice. So, and also when they become managers, a lot of them establish OT practice. Do they have enough knowledge related to that? So yeah, some students are sharp, some individuals are very sharp and they go and seek out resources, learn by themselves. But, from an OT curriculum standpoint, we need to make it a little bit more comprehensive, like including OT process and all those things. So again, the bottom line is we need to make our curriculum more comprehensive. To wrap up this session, I just want to leave all of us with a thought that, whenever we talk about quality, like if you're purchasing something, some product, like basically if the product really serves our purpose, it's really good, make us feel good, then yeah, it's a quality product, right? So basically based on the outcome, we rate the quality. So we need to ask this question again. I want to leave us all, with this question to think about is like, um, in terms of like the graduates who are entering into the field right now, how good they are, that will tell us the quality. Of course, there are multiple ways we can do. As we discussed, there is varied thoughts here. There are a lot of things we can do to improve the quality of OT education in India, but ultimately all those efforts, the outcome will only be seen when, by looking at the knowledge and competency and the confidence level in our entry level graduates. And at this point in time, I believe we have still a lot of room for improvement from that aspect. At the same time, with more OT schools, more OT educators coming to the picture with NCHP's curriculum and all, the outlook looks good. The future looks good, bright. At the same time, we really need to do a lot at this time, as a whole profession, as a whole OT community in India, to seize this opportunity, seize this momentum, to further improve the field, to further improve and empower the occupational therapy in India, the OT field in India. Thank you, everyone. I really appreciate each of you joining here and then contributing your views and thoughts. One final thing is I want you to like kind of point to the resource that, especially Harshada, when you talked about a lot of people only practice in pediatrics, we do have a more recent workforce survey report conducted by IOTTT in 2025 that's available on our website now, publicly available to anyone. So go to iottt.org and then look at the practitioner resources. You will find the report there. Again, as IOTT, we are working on several projects simultaneously, and we want to build more and more OT resources for both practitioners and student community. I invite all of you, those of you who are not yet members, please join, and also like please take part in the projects. We need more hands to do. Like we have a lot of ideas, we don't have the time and hands. So please join us and help us move forward and help us with empowering OT in India. Let us all empower OT in India. Thank you. Wherever you are, enjoy the rest of your day. And the recording of this session will be available on our YouTube channel pretty soon. Thank you.
Thank you, Karthik. Bye bye.
Thanks, Karthik. Thanks, man. Thanks all. Bye.